Good afternoon. My name is Michelle Hudacek, and I'm the Nurse Consultant Program Manager for Long-Term Services and Supports, or you probably know it as LTSS. Today, my presentation is about the Medical Review Team, also known as MRT. The objectives for my presentation are that you'll understand the role of MRT, understand the different level of care classifications, understand the long-term services and support specialist duties when requesting a level of care determination, and understand the process of MRT. So what is the medical review team's role? Well, there's an LTSS specialist and a nurse consultant who meet weekly or as needed. And during that meeting, they are determining if an individual has a need for care by reviewing physical, emotional, and social needs of the individual, considering alternative services that may be needed and available in the community. If necessary, sometimes the nurse and the LTSS specialist will make an on-site visit together to meet the individual and review their needs in their home. And this is a good time to say that consumer safety is of absolute importance, and we never should enable an unsafe situation. So if you're in somebody's home and you think, yes, we can provide services, but no, this is not a safe environment, then I would encourage you to tell your supervisor about your doubts or how you're feeling about the situation so that it can be brought to the state office and discussed before we do provide services to the individual. The MRT's role also then is ensuring that the needed services are received and that they're received in the least restrictive environment possible, and that's by the MRT team making that appropriate level of care determination. There are 4 level of care classifications that we'll be talking about. There's nursing facility care, swing bed, adult foster care, assisted living, and self-care. All of the level of care determinations are based on South Dakota Administrative Rules 674501. And you can see by this slide that I've listed out all of the different level of care classifications and the administrative rule that goes with them if you would like more information on those. So let's talk about nursing facility level of care first. Nursing facility level of care is required for 3 types of settings. Your nursing facility or swing bed, of course, assisted living waiver, and home and community-based waiver or in-home waiver. To meet nursing facility level of care, you need to meet at least one of 3 requirements. The first would be continuing direct care services ordered by a physician that can only be provided by or under the supervision of a professional nurse on a daily basis. Hands-on assistance of another person with any activity of daily living or ADL, and that's like your dressing, your transferring, bathing, etc. And the third way would be a skilled mental health service or skilled therapeutic service like physical therapy, occupational therapy, or speech therapy at least once weekly. And I did want to point out that the skilled mental health services would include meeting with a licensed therapist, appointment with a psychologist, or meeting with a case manager practicing under the licensed therapist. So when we're talking about nursing facility level of care in a nursing home or swing bed, those are the folks that are receiving very heavy care services. Those daily needs that are ordered by a physician and carried out by a nurse or somebody that's supervised by a nurse. So some examples of that would be an individual that has diabetes and they need their blood sugar checked multiple times a day, and then based upon the result of that blood sugar check, sliding scale insulin is being administered. That's something that really no assisted living could handle. It's something that you probably would need to have staff in a nursing home or swing bed be assisting you with if you weren't able to do it yourself, or if you didn't have someone to assist you at home. Another example of that nursing facility level of care in a nursing home would be somebody that needs the assistance of two people for their activities of daily living, or ADLs. And again, that's the transfers, dressing, toileting, bathing. Another example would be frequent incontinence with the inability to manage your own personal hygiene. And then a final example would be somebody with challenging behaviors that was requiring a lot of staff intervention or redirection for those behaviors. As mentioned earlier, for anyone to qualify for in-home or assisted living waiver, they must meet that nursing facility level of care classification. And this may be a little bit confusing when someone is having in-home waiver services, or they're in an assisted living and having waiver services, because we're calling it nursing facility level of care. However, a good way to remember it is that we're waiving the fact that the individual is nursing home level of care, so they can receive those services in a lesser restrictive setting, like in their home or in an assisted living. So let's look at some examples of meeting that nursing facility waiver level of care, and we'll take an assisted living example first. Medication administration in an assisted living facility may qualify somebody for waiver services if the medications are prepared and given by staff on a daily basis. That means that the individual cannot self-administer. They're not safe to self-administer. They need the staff in the facility to administer those medications daily. In a situation where you have a person that can have a pill box set up once a week, and then they can take their pills on a daily basis by themselves, you would not be able to count that as meeting the criteria for waiver. It has to be a person that's administering those medications daily, and you want to be very careful that in your community health assessment or in your CHA, you're writing a note specifically for medication administration, and that it says that this person needs the staff to administer their medications daily. Another example of meeting that nursing facility waiver level of care would be a consumer who needs assistance with bathing once or twice a week, but is independent with all other activities of daily living. So again, it's back to that criteria of needing the hands-on assistance of another person for activities of daily living. And I want to point out that it doesn't have to be paid help to meet that level of care. It can be friends or family assisting them with this bathing, and that can enable them to meet the level of care. And then, of course, a third way is any combination of skilled therapy or mental health services, as long as it's at least once a week. But I do want to caution you that if that's the only way that the individual is qualifying for that nursing facility level of care to get waiver services, that you're ensuring that you ask the consumer during follow-up calls and visits if he or she is continuing to receive those skilled therapy services once a week. Some other examples of meeting the nursing facility waiver level of care. If a home health nurse was coming into someone's home daily to change a dressing to a wound, that would be meeting that level of care, because again, it's that daily need that's ordered by a physician and carried out by a nurse. Earlier I had mentioned about the consumer who needed assistance or hands-on assistance with bathing, and that would be a qualifier. There's one caveat to that. If an individual has cognitive impairment but is physically able to do their activities of daily living, but they do need supervision and cueing in order to carry out that activity of daily living, that would also qualify them for that level of care. It's just very important that on your community health assessment or your CHA, that you're journaling an entry that says, without cues and reminders, this individual would need a higher level of care. Some examples, other examples that you might want to document for the individual. Their memory is poor. They require multiple reminders throughout the day to use the restroom, so they maintain continence. Or their memory is poor. They require supervision and cueing to take their bath. Just being very specific in the CHA. Moving on to another level of care, we'll talk about adult foster care. This is a family-style residence which provides supervision of personal care, health services, and household services for no more than 4 aged, blind, physically disabled, developmentally disabled, or socially, emotionally disabled adults. The criteria for adult foster care is that they're not able to live independently, but they don't pose a danger to themselves or others, and with direction, they're capable of taking action for self-preservation in emergencies. These folks may require some supervision, but it should be very minimal assistance that they're receiving. An example might be somebody that just needs housekeeping services or meal prep or managing their finances or shopping. Really, if they're needing a lot of physical assistance, adult foster care would be the wrong level of care for them. Another level of care that we'll talk about is assisted living level of care. Now, these folks don't require that real heavy care and assistance that somebody in a nursing home or a swing bed would require, but they do need supervision 24 hours a day, or they need to have assistance available 24 hours a day to enable that individual to carry out their activities of daily living. Assisted living facilities are licensed by the Department of Health. The last level of care that we'll talk about is self-care, and this is when the individual is cognitively and physically independent and able to use resources without any assistance from long-term services and supports. So let's spend a little bit of time talking about the LTSS specialist's duties. Of course, it's to complete the community health assessment, or the CHA, and make sure that the documentation in the CHA is accurate, that you're putting those additional notes in or journal entries to clarify any qualifying criteria. That's very beneficial to the nurse consultant when she is reviewing the information. Another thing is to obtain the physician order, and that's Form 659, and ensure accuracy before you're submitting it to the nurse consultant or to the MRT. Once you've got everything done, you're submitting the information to the MRT, and the designated specialist for MRT and the nurse consultant will meet, review the information, and make the appropriate level of care decision. The next slide I wanted to include because it is an example of that physician's order, And I wanted to point out, when I said earlier to make sure that it's filled out accurately, I wanted to point out the important things. First of all, only one primary diagnosis and ICD-10 code should be listed. You want to make sure that if the person is getting waiver services, that box is checked that says has a medically necessary need for in-home services. You want to make sure that the national provider ID number is entered on that form, and that is for billing purposes. You want to make sure that the signature of the physician is on the form, and in some instances, the nurse from the clinic will try and sign that form, and that's not allowable. It needs to be the physician's signature. Nurse practitioners and physician assistants can sign the form. And then, of course, the date of the signature. And I want to point out that the date must be within 60 days of when the level of care is submitted to the MRT. So everything is recent and pertinent. The duties for the nurse consultant then are to make sure that those MRT meetings are being held at least weekly, that all of the information is being reviewed, and that the recommendation is made. And while the MRT team is doing all of their things, at the same time, economic assistance is reviewing the financial side of things. When level of care determinations are being made, a lot of information is going into that process. They're looking at the person's medical conditions, what diagnoses do they have? Do they need any specialized care or treatment, like the skilled therapy services, mental health? What's their cognitive status? Are they forgetful? Do they have memory problems? What are their social needs? What are their physical assistant needs? What do they take for medications? Are they capable of self-administering, or do they need someone to administer them? What types of equipment do they need? Walker, cane, commode, wheelchair. So just a lot of different things are being looked at when that MRT process is happening. This next slide is a map of the MRT regions. You can see that there are 5 nurse consultants located across the state. Crystal Heyman is located in the Rapid City office, and she covers Region 1. Tony Rounds is located in the Huron office. She covers Region 2. Cassandra Varlick is located in the Watertown office. She covers Region 3. Lori Balzer is located in the Olivet office, although she does sometimes travel to Yankton, and she covers Region 4. And Tricia Fierstead is located in the Sioux Falls office, and she covers Region 5. So when do you request a level of care review? Well, of course, anytime an initial request is made, anytime a choice is screened, prompts a CHA to be done, a level of care determination should be made. And even if it's felt that the individual will be determined self-care, it's still important to complete the level of care process to show that everyone's being evaluated. Whenever a setting change happens, a level of care review should be requested. And what I mean by setting change is, let's say somebody is in an assisted living, they have a fall, the physician thinks that they need to go to the nursing facility for a while to get some rehab, and then they come back to the assisted living. With each setting change, there should be a new level of care request. And then, of course, an annual review. Annually, the MRT must assess and review the justification of every recipient's level of care. Just a few reminders. Annual reviews should be done timely enough so that the specialist has time to visit the consumer, obtain the medical documentation, get the physician's order, and still give MRT 1 to 2 weeks to complete their review before the deadline. Submission to MRT should be by the 20th. And the reason that we're asking for that to be done by the 20th is because the nurse consultants have other job duties. One of the things that they do is help administer the pre-admission screening and resident review process in South Dakota. You might know that as PASSAR. And if you aren't familiar with that, it's anyone seeking entry into a Medicaid certified nursing home or swing bed must first be screened to determine if they have a serious mental illness or intellectual development or developmental disability. If they do, then we need to ensure that nursing home is the most appropriate and least restrictive setting for them to have their needs met. The nurse consultants also go out and travel to facilities within their region, nursing homes within their region, and they do case mix reviews of approximately 15% of the nursing home's population. And so just having all of this stuff to MRT by the 20th will allow them to manage their time more efficiently. The LTSS specialists do not review their own submitted cases. The nurse consultant will contact an alternate MRT specialist for consultation if and when that's needed. And I just wanted to mention that if you ever have any questions on level of care, like maybe you're wondering why someone didn't qualify or didn't meet level of care, don't be afraid to ask for more information or seek clarification when necessary. So the final steps of the process then, the nurse consultant sends all of the level of care determinations to economic assistance after the MRT review it. And then once the consumer has met financial eligibility criteria, receives an appropriate level of care determination, placement has occurred within a Medicaid certified facility, or waiver services have started, then the consumer will have met eligibility for Title 19 reimbursement for care. If you have any questions after this presentation, please feel free to contact me. My direct line is 605-773-6917, or you can contact me by email at michelle.hudacek@state.sd.us. Thank you.